control of non-communicable diseases, and our health consult diligently developed this evidence-based investment case. It reflects a collaborative, multidisciplinary effort combining mental health professionals, health economists, and social development experts, all driven, by a shared goal, and that is to show why and how investment in mental health is both a moral obligation and a wise economic choice. The findings are both insightful and persuasive. The figures, which will be shown to you very soon, clearly demonstrate that mental health is not just a health issue. It is also an economic and development concern that requires urgent and continuous investment. The investment case, therefore, offers us not only the data, but also a roadmap for action. On behalf of the Ministry of Health, I would like to express deep appreciation to our partners, WHO, the UN Interagency Task Force, our health consult, other experts, that is the mental health professionals, and all stakeholders for their technical and financial support in developing this landmark report. As we officially commence the launch of the Gambia Mental Health Investment Case today, the Ministry of Health urges us to renew our collective resolve, to turn these findings into tangible actions through legislation, funding, partnership, and innovation. The Ministry of Health wishes us a successful and impactful engagement ahead. I thank you.
Few remarks on the legislative priorities in the case of mental health. As we are launching this mental health investment case report 2025, as said by the MC, the very second of its kind in West Africa and 12th in the world. We are privileged and indeed happy to be partners in this journey. I could recall some times back, we are also invited as a National Assembly to give a statement at the launching of the mental health policy developed by the Ministry of Health. I have to say that the Ministry of Health priorities as far as mental health is concerned is key, and they are giving it their utmost best. And I can assure you that from the point of the National Assembly, on behalf of the Speaker, and of course on behalf of the National Assembly Authority, we are sort of our full support with regards to legislation, with regards to oversight, and of course with regards to resource allocation. Because we've also heard from the Permanent Secretary that there are three things involved here: legislation, budget, and of course partnership. And all this have to deal with the National Assembly, directly or indirectly. There is no lawmaking body in the country apart from the National Assembly, and there is no institution that allocates resources apart from the National Assembly. And of course, if you want to achieve this, you have to partner with us. So this is a right call in that direction. PS, Minister of Health and team, we are happy to be here, and we are sort of our full support as far as legislations are concerned. We are looking towards receiving the mental health bill and any other legislation that have to deal with health. And again, on behalf of the Speaker, all legislation coming from the Ministry of Health are always given utmost priority they deserve. Even sometimes we have to not even do the normal process, but from first reading, second reading, we say, let's take it to the Committee of the Whole House to consider it straightforward. In normal circumstance, we have to go out to the public, maybe do some consultation. Sometimes a bill can be there for a year or so. But with regards to bill from the Ministry of Health, because we know these are bills and legislation that affect our people directly, the people that we represent. And like I always say, if anything affects the Gambian people directly, it affects us, because they are the ones that put us where we are. We are their representatives. If you touch them, you touch us. If you prioritize them, you prioritize us. So, Ministry of Health, be assured that you have prioritized the Gambian people in this regard, and in the case of mental health. And then I have to tell you that you have prioritized the National Assembly, and the National Assembly prioritized all your agendas. Thank you so much.
In particular, the United Nations Interagency Task Force on the prevention and control of NCDs, the World Health Organization, the United Nations Development Program, as well as the United Nations Population Fund and the Office of the High Commissioner for Human Rights. Mental health affects over 12% of our population and accounts for over 6% of our overall disease burden as a country. Yet, for decades, mental health has been sidelined, overlooked, and underfunded. This report changes that. This report indicates our actions, the cost of our inactions, but also demonstrates the benefits of investing and the return on investment. A national investment case on mental health is a quantitative analysis that is designed to make an economic argument for investing in mental health. It is a valuable instrument for assessing the economic burden of mental health in a country, and that makes it a powerful tool to make, actually it's aimed for policymakers and the wider stakeholders. But this also indicates that the changes that are needed, and also fosters the multi-sectorial collaboration and dialogue. The total burden of mental health. So, looking at in methodological terms, mental health investment case report has two interrelated critical components. One is the economic analysis, the second is the institution and context analysis. For the economic analysis, there are 4 critical steps. Number 1, it enables us to calculate the economic burden of mental health in a country. The second is it helps us to assess the cost of scaling up of interventions. Third, it helps us to understand the benefits of the interventions at national level. And the fourth, which is the last but not the least, it helps us to understand the return on investment. For the institutional and context analysis, in addition, helps us to understand the status and the context of mental health in a country, but also helps us to engage the national key stakeholders. And this makes the mental investment case report a very powerful advocacy tool. This report, the Gambia Mental Health Investment Case 2025, highlights 8 priority conditions. These include clinical care for bipolar disorder, psychosis, epilepsy, depression, anxiety, and alcohol use disorder. Additionally, there are 2 preventive programs. We have the school-based mental health program, as well as the suicide prevention through community awareness. The total economic burden of mental health and suicide in the Gambia is estimated at $767.6 million. The total economic burden of mental health in the Gambia is estimated at $767.6 million. That is equivalent to 0.4% of our GDP. 7.4% of that represents the direct costs. These are just treatment. When people go to the facilities or the health facilities, they buy medicines, electronics sometimes from private pharmacy. The $760.2 million, that is the remaining, represents the indirect costs. That represents the indirect costs, and these are absenteeism. For example, people are absent from work or from school due to a mental health concern or a mental health condition. Presenteeism, being at work or at school, but you're unproductive or you're not effective. The third is loss of a life due to mental health condition. These are not just numbers. These represent lost productivity, broken homes, broken families, and shattered communities. The report also gives us hope. There are model interventions, if we make them priorities, can yield $850 million over 7 years. And we can afford to lose these benefits. Beyond the numbers, this report also calls for action. It has a clear roadmap. It calls for multi-sectorial, whole of government, whole of society's approach to mental health. And this includes legislative reform, community engagement, and prioritization of mental health funding. Out of the 8 priority conditions that I mentioned earlier, the most cost-effective and impactful conditions for interventions are alcohol use disorder, epilepsy, and depression. So if we take depression, for example, every $C we spend on the management of depression, we have the cost ratio benefit of 7. This is not just a health benefit, it's also an economic benefit. The Ministry of Health has taken bold steps. Mental health is now a priority public health concern. We have the National Mental Health Policy 2025 to 2035, which has been recently validated. We're finalizing the final steps of the mental health bill, working with the legal experts from the Ministry of Justice and international consultants. The development of a cost-based strategic plan is underway to align with national development goals. We are making progress in the service delivery. Mental health is now being integrated into primary health care. We have launched our school mental health program supported by UNICEF, and we are engaging communities. We are partnering with the media and other stakeholders to challenge stigma head-on. The report also included a SWOT analysis. It outlines our strengths, and that is government commitment, international partnership, and the community-based initiatives. It also highlights our weaknesses, outdated law, persistent stigma, and critical shortage of resources. The opportunities are ongoing reforms, new programs, as I mentioned earlier, and the continuing engagement of the public on mental health promotion and education. But we must be mindful of the threats. Limited funding, competing priorities, and workforce. There is critical shortage of mental health professionals. We are just 20 in the country, and the attrition rate is very high. This has affected our services across the country and has made it challenging to have sustainability in certain initiatives across the country. The report highlighted critical recommendations. Repealing the Lunatic Detention Act of 1917 is overdue. We must pass the mental health bill to promote a rights-based and community-focused care. The Ministries of Justice, Education, Gender, Health should collaborate, may have national plans and technical working group on mental health. We should continue working with our international partners to scale up actions and infrastructure. Traditional healers are very important. We should integrate them into the formal system through training and structured referral pathways. Workforce. I'm particularly concerned because I'm a mental health professional and I know how it feels like working in a resource setting when I used to be at the hospital. Like I mentioned earlier, we're just 20. So training, retention strategies, and curriculum reform is essential in this case. We need targeted intervention for returning migrants, youth affected by substance use, and women impacted by gender-based violence. I will leave with this. Mental health is not a side issue. It is central to our vision of inclusive, productive, healthy post-porous Gambia. And this report provides us the opportunity. Let's act now together. And remember, there is no health without mental health. Thank you.
On the established protocol, ladies and gentlemen, good morning. It is indeed a great pleasure and an honor to join you today for the launch of the Mental Health Investments Case Report. This is a milestone in our health development, not only for our health system, but for the well-being, dignity, and productivity of every Gambian. Mental health is not just a health issue, it is a human rights issue, it is a social issue, and it is an economic issue, one that touches every family, every community, and every aspect of national development. Yet, for far too long, mental health has remained invisible, spoken of in whispers, often misunderstood, and too often left behind when we are planning and financing our health services. Around the world, there's a growing recognition that there is no health without addressing mental health. 1 in every 8 people globally lives with a mental health condition. Perhaps you may not be part of that statistic, but when they mention presentism, absenteeism, perhaps those days when you don't feel like working, it's a reflection of your mental health status. So rather than looking at those perhaps who are too sick and are institutionalized, look at yourself and the people around. Maybe we all have a mental health situation that hasn't been recognized. So through the WHO Comprehensive Mental Health Action Plan, countries are working together to make mental health care accessible, affordable, and stigma-free for all. Having words like Lunatic Detention Act are not for this century. Words like that should not be used to describe people who have mental health challenges. Today's launch places the Gambia at the forefront of this global movement of demonstrating leadership, commitment, and compassion. The mental health investment case we're unveiling today provides powerful economic and social evidence that investing in mental health is not a cost, it is a gain. It's very good business when you consider the dividends and gains you get when you address mental health. For every dollar invested in mental health promotion and treatment, there is a return of $4 in improved health and productivity. That's not just a statistic, it's hope quantified. Allow me to share a few stories that remind us why it matters. There's a young woman named Tandy. She was in her early 30s, bright, energetic, and full of life. But after losing her only child, she fell into deep depression and anxiety. For months, her community thought she was just weak or possessed, suggesting all kinds of remedies, some of which are unmentionable in a forum like this. It was only when a community health nurse trained through WHO's Mental Health Gap Action Program, or MHGAP, recognized her symptoms and linked her to care that she began to recover. Today, Tandy has rebuilt her life. She's working again, she mentors other women, and she proudly says, mental health care gave me back my life. That is the kind of transformation we're all here to make possible for every Tandi, for every man, for every woman and young person, and perhaps that guy at the corner of your village who has been neglected, whose struggles are too often unseen or neglected. I'm also reminded of a friend of mine I'll call Mr. B. He's a globally recognized top scientist and public health practitioner at the top of his field. The last time I checked, he had published over 320 articles in peer-reviewed journals, written several chapters in several books, and came up with innovations that were well ahead of his time. One day we were talking, and he revealed to me that he was epileptic. The difference between Mr. B and other epileptics is that the diagnosis was made early, he's on effective treatment, and has made his mark globally. That can be the story of many Gambians if we do what the investment case has so clearly spelled out. WHO is proud to stand with the government of the Gambia and the Ministry of Health on this important journey. Through our ongoing collaboration, WHO has trained health workers using the MHGAP toolkit to detect and manage mental, neurological, and substance use or abuse conditions, supported the review and development of national mental health legislation and policy, promoted the integration of mental health into primary health care, and strengthened data, research, and advocacy to guide national decisions and investments. Together, we are ensuring that mental health care is available where people live, learn, and work, bringing help closer to communities and reducing stigma along the way. As we move forward, WHO remains fully committed to supporting the Gambia in implementing the priorities identified in this report, strengthening governance and financing, improving service delivery, addressing stigma and discrimination, and ensuring that no one is left behind. When we invest in mental health, we invest in human potential. We invest in dignity, and we invest in the very foundation of a healthier, more resilient Gambia. So on behalf of the World Health Organization, and indeed the UN family, although my boss will come and say some more, I congratulate the government of the Gambia, the Ministry of Health, and all our partners on this remarkable achievement. I would like to thank in particular staff from the WHO, UNFPA, UNDP, the UN Interagency Task Force on NCDs, Health Consult, and other UN organizations and CSO who have supported this work. And we pledge that we will continue to support the government of the Gambia in her efforts for health for Gambians. Together, let us continue to make mental health a national priority for every community, for every Gambian, and for generations to come. Thank you so much, Jerry Jeff.
Assembly, the chairperson of the Select Committee on Health, senior government official here present, His Excellency the Ambassador of the Republic of Turkey and other representatives of the Diplomatic and Consular Corps, permanent secretaries, UN colleagues and friends, media personnel, welcome. It is an honor for me to join you today for the launch of the Gambia Mental Health Investment Case Report. This is an important moment for the Gambia, one that signals a bold commitment to ensuring that mental health is treated not as a luxury, but as a fundamental human right. It is also an opportune and timely development coming in the wake of the commemoration of the World Mental Health Day on October 10th, a day that calls for global attention to the importance of mental well-being and the need to uphold the rights and dignity of all people living with mental health conditions. Mental health is inseparable from human dignity. The right to mental health is a fundamental human right recognized under the international human rights law, including the Universal Declaration of Human Rights and the International Covenant on Economic, Social, and Cultural Rights, which affirms the right of everyone to the highest attainable standard of physical and mental health. Despite this recognition, mental health remains one of the most neglected areas of global health. People living with mental health conditions continue to face systemic stigma, discrimination, and exclusion from society in clear violation of their rights to equality, to non-discrimination, and full participation in society as affirmed by all instruments, such as the Convention of the Right of Persons with Disabilities. Ensuring the realization of the right to mental health requires urgent action to dismantle barriers, promote dignity, and integrate mental health into aspects of health and human dignity rights policy. This investment case represents the Gambia's determination to take the necessary action toward realization of the highest attainable standard of physical and mental health. Ladies and gentlemen, today's demonstrate the investment in mental health is not only a moral imperative, but it is also a smart investment in our collective future. Mental health is central to achieving all sustainable development goals. It underpins the SDG number 3 on health and well-being, but its influence extends across the entire 2030 agenda, particularly for marginalized groups. Therefore, good mental health enables children to learn and reach their full potential in education. It empowers women and girls to participate in full society. It enables people to engage in decent work and contribute to economic growth, and it is essential to reducing inequalities and building peaceful and inclusive societies. We must also confront the growing threat of substance abuse, which has emerged as a leading cause of mental health challenges in many countries, including the Gambia. Our streets and communities have been infiltrated by dangerous drugs like kush, gao, skong, and others that are destroying lives, particularly amongst our young people. Substance abuse and mental health are deeply intertwined, creating a vicious circle that demands urgent, comprehensive, and full action. We must strengthen prevention efforts, expand treatment and rehabilitation services, and address the social and economic factors that make our youth vulnerable to addiction and abuse. Protecting our young people from these substances is protecting their mental health, their future, and the future of the Gambia itself. So finally, the evidence is clear. Every $C invested in mental health generates multiple returns in improved health outcome, increased productivity, and stronger communities. Yet mental health continues to receive a fraction of the resources that it needs. Therefore, this investment case provides the Gambia with a roadmap to close this gap. The United Nations stands firmly with the government of the Gambia in this journey. We are committed to supporting the government, the civil society, and the communities to translate this investment case into action that reaches every one person, every community, leaving no one behind. I would like also to extend my congratulations to the government of the Gambia, the Ministry of Health, and all of those who have contributed to the development of this investment case. The document is not only a call to action, it also serves as a guide, as a strategic tool to inform planning, guide resource allocation, and promote coordination action across government, civil society, and all development partners. Along with WHO, the World Health Organization, and all other partners here present, we remain committed to supporting the Gambia to translate this investment case into tangible improvement in mental health. Together we can build a future where mental health is valued, protected, and promoted for all Gambians. Finally, let me close by saying that it's important to ensure that mental health services are accessible, affordable, and rooted in respect for human rights and dignity, and it's important to break the silence and shatter the stigma. And let us build a Gambia where everyone can enjoy the right to mental health, but also to sustainable development. Thank you.
Thank you very much, MC Fatmata Koma. Well, there are a lot of other cards, so we waiting for this Saturday. You have a lot of emails to write. Your Excellency, the Vice President of the Republic of the Gambia, Mr. Mohamed B.S. Jallo, colleague cabinet ministers here present, the Chairman of the National Assembly Select Committee for Health and other National Assembly members here present, the Ambassador of the Republic of Turkey and other members of the Diplomatic Corps, the UN Resident Coordinator, WHO country representative and other heads of UN agencies here present, the permanent secretaries and senior government officials here present, representatives of the National Human Rights Commission, representatives of the civil society organizations, colleague health professionals here present, individuals having mental health challenges here present, and a special recognition for a veteran, Uncle Dr. Lamin Sidibe, who is in our midst today. Your Excellency, at some point we would like to present Uncle Dr. Sidibe for all the hard work he's been doing behind the scenes to support mental health in this country. Media personnel, distinguished ladies and gentlemen, it is with great honor and deep conviction that I address you today at the launch of the Gambia's Mental Health Investment Case Report 2025. This is not just a milestone, it is a turning point in our collective journey towards a healthier, more inclusive, and more compassionate Gambia. The government of the Gambia recognizes mental health as a public health priority. This commitment is reflected in the National Mental Health Policy 2025 to 2035, as well as the finalization of the draft mental health bill, which aligns fully with our national development goals and the health sector strategic plan. Mental health is now rightly considered a critical component of overall health and well-being. The Gambia Mental Health Investment Case supports our efforts to strengthen mental health care programs and clinical services through accessible, cost-effective, and culturally appropriate measures. This report provides us with the evidence we need to act decisively and boldly. It shows that investing in mental health is not only a moral imperative, but also an economically sound, socially transformative activity, and which is very essential for achieving universal health coverage that we all yearn for. In short, every dollar we invest in mental health strengthens our economy, our communities, and our future. The investment case further highlights specific mental health conditions that contribute significantly to the mental health burden, along with government expenditure and out-of-pocket costs borne by Gambians. Our government's recognition of mental health as a priority issue, coupled with active engagement with partners to align mental health policies and legislation with international recommendations, lays a favorable foundation for improving mental health outcomes in the Gambia. Our country's gradual efforts to enhance human and material resources for mental health are now approaching a tipping point, ushering in a new era where cost-effective and culturally appropriate interventions that will bring mental health care closer to the people, including through primary health care, community outreach, and schools, can and will make a tangible difference. As Minister of Health, I reaffirm our commitment to reforming mental health legislation to uphold human rights and access to care, expanding community-based services, and integrating mental health into primary health care. We will work with our partners to ensure that no one is left behind, especially women, children, and vulnerable populations, because mental health is everyone's business. Allow me to express my sincere appreciation to the technical team for their dedication and all our development partners for their steadfast support. In particular, the Secretariat of the United Nations Interagency Task Force for the Prevention and Control of NCDs, the World Health Organization and the United Nations Development Program, the Office of the United Nations High Commissioner for Refugees, and the United Nations Population Fund for their trust and collaboration, as well as our health consult for their technical support. Distinguished guests, we thank His Excellency, the Vice President, for agreeing to launch this very important document. This shows the high level of commitment the government of His Excellency President Barrow attaches to the health and well-being of the citizenry and all those who live in the Gambia. Distinguished guests, ladies and gentlemen, it is no longer a secret that this government is totally committed to the health and well-being of the people of this country. We have seen the infrastructure expansion in the health sector. We have seen the capacity building initiatives. We have seen the massive procurement of life-saving medical equipment to ensure that the people of this country get the best of care. As His Excellency rightly says, he's laying down the foundation for development of this country. Wonderful policies, modern policies, good laws, good roads, good hospitals, good schools, a good system for this country. I think the march to development in this country has started, and we are happy that the health sector is not left behind. At this juncture, Your Excellency, colleagues, today's launch is not the end of the project. The real work starts now in translating this evidence into policy, into budgets, and ultimately into better lives for Gambians in every region, every community, and every household. At this point, we are very, very keen in waiting and listening to His Excellency's inaugural speech, which will go ahead to strengthen our resolve as a country and to encourage us more to put in our best, because he's going to read out what the government's plan is for the whole sector and for the mental health program. Your Excellency, I promise to present to you Dr. Sidibe. Dr. Sidibe is a personal uncle of ours. Dr. Lamin Sidibe, if you could kindly stand for His Excellency and the people of this country to see. Well, he went to school with my dad. They used to be together from primary school to now. So these ones have seen us grow. But we can see his passion in ensuring mental health care in this country and the support he's giving to the young ones. Because now he could have stayed at home, but he said, no, I must continue to support the young ones. And we are enthusiastic, we are appreciative, Your Excellency, that we have so much support from yourself, from His Excellency, and from a lot of very good partners. And I myself am very optimistic. Ms. Koma has just mentioned it here. I want to reassure you, we have the personnel, we have the team, we have the commitment to ensure that the vision you and His Excellency have for this country is fulfilled. So have no doubt that in the health sector, we have very, very wonderful, hard-working, committed people to deliver to the people of this country. Thank you very much for your kind attention.
For my voice, where I'm suffering from a cold. The Honorable Minister of Health, the Honorable Minister of Foreign Affairs and Governments Abroad, Honorable Minister of Works, Infrastructure, and Honorable Minister of Digital Economy, the Ambassador of the Republic of Turkey and other members of diplomatic and consular corps here present, the UN Resident Coordinator, and the WHO representative, other members of the UN system here present, the Chairman of the Select Committee of Health, the National Assembly, other National Assembly members here present, senior government officials, the press, all other protocols duly and respectfully observed. It is a great honor to welcome you to this important gathering, one that touches every heart, every home, and every community. That is mental health. Today, we speak not only about an aspect of health, but about the essence of who we are, our ability to hope, to connect, to persevere, and to care for one another. For too long, mental health has lived in silence. It has been hidden behind stigma, whispered about instead of understood. Yet, mental health is not a distant issue. It is close. It is personal. Every family knows someone who has struggled, even if we do not always speak their name. The truth is simple. There is no shame in mental illness. The mind, like any other part of our body, can need healing. When someone seeks help for depression or trauma, it should be treated with the same compassion and urgency as a broken limb or malaria. We cannot accept a reality where those in mental distress are left to face it alone. Distinguished guests, ladies and gentlemen, we must transform how we think about mental health from something to be feared or hidden to something we talk about openly, address with compassion, and resource with the same urgency as any other health condition. In the Gambia, every citizen deserves the chance to live with dignity, purpose, and peace of mind. Our strength as a nation lies not only in the health of our bodies, but in the resilience of our minds and the compassion of our communities. We cannot build the Gambia we aspire to, a just, prosperous, and peaceful nation, if our people are weighed down by distress, trauma, or hopelessness. This is why mental health is not only a medical concern. It is a national development priority, a human rights issue, and a moral duty. Consequently, poor health leads to lost income, broken families, and lower productivity. It affects education, employment, and national cohesion. When a young person's potential is lost to untreated depression or substance misuse, the nation loses part of its future. When trauma goes unaddressed, it can echo across generations. This is why mental health must be embedded in all sectors, from education to justice, agriculture to finance. A teacher must understand the emotional needs of students. Police officers and judges must respond with empathy to those in crisis. Community and religious leaders must help end stigma and promote understanding. In this effort, every ministry has a role, every partner has a responsibility, and every Gambian has a stake. Our government, under the leadership of His Excellency President Adama Barrow, is committed to ensuring that mental health is not left behind in our journey towards universal health coverage. We are working to ensure that care and compassion reach every region, not only in our hospitals and clinics, but in schools, workplaces, and communities. We are reforming laws and policies to protect the rights of those living with mental health conditions. And we are fortunate to have strong partnership with the UN system, civil society, and development partners to build a more inclusive and humane system of care. But beyond policies and plans, the true test lies in how we as a society treat one another. The government alone cannot do this. Families, faith leaders, educators, employers, the media, all have a vital role to play in creating a culture that embraces mental health well-being. We must move from judgment to empathy, from stigma to solidarity, because mental health is everyone's issue. It affects our children, our elders, our teachers, our police officers, our health workers, all of us. When one person suffers in silence, a part of our collective humanity is diminished. Let us therefore speak openly, act boldly, and lead compassionately. Let us make it known that seeking help is not a sign of weakness, it's an act of courage. And let us support our health professionals, community workers, and families who carry this important mission forward every day, often with limited means but with great heart. Excellencies, ladies and gentlemen, we live in a time of profound social and economic change. Our people face many pressures, from climate shocks to the rising cost of living, from displacements to unemployment. These challenges do not only test our resilience as individuals, they test our collective capacity to care. This is why now, more than ever, we must build systems and a society that nurture mental well-being. Because when people are mentally healthy, they learn better, work better, and live better. And when the mind is strong, so too is the nation. This is the vision we must hold. A Gambia where mental health is valued, protected, and promoted. A Gambia where every person, young or old, rich or poor, rural or urban, has access to care, understanding, and opportunity. A Gambia where we see mental health not as a burden, but as a foundation of human potential. Let this be our commitment today, to build a society that heals the mind, uplifts the spirit, and restores hope. Because when every Gambian can live with this peace of mind, our nation will truly strive. I thank you for your kind attention.